Good morning. On behalf of Team 6, I am Wissam Rad, my teammates Jake Sutton, Kyle Heidenberger, Chizoma Amadi, Yazan Mudallal, Megan Gomez, and Sylvia Munoz Price. We will be talking about the multimodal health system, particularly for the country, the United States of America. We hope you enjoy this talk. The agenda will include a health system model overview. We will discuss the country information. We will also discuss the health system structure, the health system performance, and the notable innovations and the opportunities for improvement. Starting with the health system model overview, this picture briefly describes the key players and processes in the United States healthcare system. In summary, the patients are funded for healthcare through either an insurance company that they pay for through an insurance premium or through their workplace, or alternatively they can be funded through the government via Medicare or Medicaid that subsequently pays for the health services. In general, the United States health system is a complex mix of public and private providers and payers with a variety of financing and delivery models. So the public programs include Medicare, Medicaid, military, and other programs that are funded by the government. They provide coverage for mostly seniors over the age of 65, or to patients who are low income individuals and the disabled, or also to veterans and military through the VA health system. On the other hand, the private insurance, which is covered through employers or purchased by patients, covers most Americans younger than 65. I'll briefly discuss the model history. During the colonial era, the medical care was provided by individual practitioners and charitable organizations. The first hospital in the United States, which is Pennsylvania Hospital, was founded in Philadelphia in 1751. During the 19th century, medicine became more scientific and professionalized. Medical schools were also established. However, it was still largely unregulated. It was not until the 20th century when the first prepaid health insurance was established. The Great Depression and the World War II further fueled interest in healthcare reform. In 1946, President Truman proposed a national health insurance program, and in the 1960s, the federal health care programs were established, including the Medicare and Medicaid. In the 1970s, managed care organizations, which sought to control healthcare costs by managing patients' utilization of medical services, was established. And in the 1990s, the government attempted to reform the healthcare system through the Clinton healthcare plan. Finally, in the 21st century and in 2010, the Affordable Care Act was passed, and the goal was to expand access to healthcare and controlling costs. Despite ongoing debates about the effectiveness and sustainability of the Affordable Care Act, it remains a significant part of the US healthcare system today. In general, the United States health system has some strengths and weaknesses. Particularly, it is well known for the technological advancements and innovations. The country is home to some of the world's leading medical research institutions and hospitals. Healthcare providers have access to the latest medical technologies and treatments, and there's a high number of healthcare providers per capita. So patients have access to a wide range of medical professionals and services. The main weaknesses are one, that the United States health system is one of the highest healthcare expenditures per capita in the world. It's not universally accessible with millions of uninsured people, and there is a cost of healthcare that is a major concern in the United States. The healthcare expenses are actually a significant contributor to the country's national debt. Like most major health systems, the United States healthcare system is subject to ongoing debates and improvement. This includes expanding access to coverage, reducing costs, improving quality of care, providing a universal healthcare system covering many patients who are uninsured right now, and increasing government regulation of healthcare prices, as well as encouraging more competition among healthcare providers. I will now pass on to my teammate Jake to discuss the country information.
Thanks, Wissam. So the U.S. consists of 50 states and the District of Columbia. Its total population is about 339 billion. There are various ethnic groups, with white being the largest group, accounting for 61.6% of the population. And currently, 12.8% of the population live in poverty, and 8.6% are without health insurance. The US is the world's largest country by size, after Russia and Canada, and population after China and India. And the life expectancy at birth include a mean age of 78 years for males and 82 years for females. So let's now take a look at the US national health expenditure. So these graphs show a forecast of the national health expenditure per capita and as a percentage of GDP from 2021 to 2030. And according to projections from CMS, healthcare spending in the United States is expected to continue to rise over the next decade. And as of 2021, the national health expenditure was approximately $13,000 per capita, or roughly 18.8% of the country's GDP. By 2030, this figure is expected to exceed $19,000 per capita, or 19.6% of GDP. Now let's take a look at the primary health issues and disease burden in the United States. First, the leading cause of death in the US is heart disease, accounting for 21.1% of all deaths in 2021. Second, cancer is the second leading cause of death in the US, accounting for 17.5% of all deaths in 2021. And lastly, in 2021, COVID-19 was the third leading cause of death, accounting for 12% of all deaths that year. However, other issues such as accidents or unintentional injuries have had a longer duration of impact in the United States. So now let's move on to the pest analysis. First, let's start with political factors. The US is a constitutional federal republic with separation of powers, meaning that sovereign powers are shared between the central government and the state governments. And political power is divided among three government branches: the legislative, the executive, and the judicial. There are currently two major political parties, the Democratic Party and the Republican Party, which currently dominate the political system. Moving on to economic factors, the US has the second largest economy in the world after China, with a GDP of over $21 trillion in 2021. The country's healthcare industry plays a major part in the economy, with healthcare spending accounting for over 18.8% of GDP in 2021. However, there are concerns about how rising inflation rates, which peaked at 9.1% in June of 2021, will impact medical prices in the future, particularly higher medical prices and steeper health insurance rates. Next, we have the social factors. The US is a diverse country with a multicultural society. Its population varies in age, race, ethnicity, and religion. However, there are also ongoing social issues such as a growing aging population, with the baby boomers generation reaching retirement age, that could strain the healthcare system, potentially leading to an increased demand for healthcare services. particularly in areas such as long-term care. Additionally, while the U.S. has a strong healthcare workforce, there is a current shortage of nurses, which is likely to increase as baby boomers age. Finally, we have technological factors. The U.S. is the world leader in technology and innovation, particularly in healthcare technology. The country is experiencing rising digital health trends right now with new medical technologies such as AI, wearables, and telemedicine, which are changing the healthcare landscape, notably transforming the way healthcare providers provide care, with over 80% of physicians using telehealth in 2020. And that the country is making large investments in this area, amounting to about $29 billion in 2022. So the trend in digital health technology is likely to continue. And this brings me to the end of the country information. Now I will turn it to Kyle, who will present the U.S. health system structure.
Thank you, Jake. As previously mentioned, my name is Kyle Heidenberger, and I will be covering the structure of the U.S. healthcare system. The multimodal structure of the U.S. healthcare system can be organized into 4 distinct entities. The private insurers, providing funding for care to nearly 2/3 of the U.S. population. The government, establishing and reinforcing the standards and quality of care, which will be discussed in more detail later in this section. In addition to its regulatory role, the government also provides subsidiary funding and care to patients left open to certain gaps in coverage from the privatized system. Third, patients in the United States requiring medical care. And lastly, the physicians, facilities, and other healthcare professionals providing care to U.S. patients. How healthcare delivery is funded in the United States is a complex landscape that can be summarized by the flow of funding from private households to healthcare providers through a series of specific pathways. The largest contribution of funding for healthcare services is from cuts in paychecks by private employers that are passed on to providers through private health insurance companies. In addition to these paycheck contributions, U.S. citizens are taxed at the local or state and federal levels to fund public programs such as Medicare and Medicaid. For those who do not opt into private insurance coverage or do not qualify for the subsidiary funding, out-of-pocket payments can be made at the point of service to healthcare providers for services or by means of other private spending. Regarding the governance and structure of the U.S. healthcare system, oversight occurs at 4 different levels. At the highest level, the federal government lays out national legislation and strategies for the regulation of healthcare delivery in the United States, including pharmaceuticals and medical devices. Additionally, they establish the criteria for which reimbursement for care with government dollars for Medicare services that private institutions is provided, as well as coverage for government employees, active military veterans, and their families. Now, because states have reserved authority to exercise their own political powers by their own authority, each state has the right to pass, enforce, and promote their own laws within the confines of what is outlined in the U.S. Constitution. This most recently is being played out in the form of each state expressing differing opinions on what they will legally provide as far as reproductive care for women. Within each state, local health departments are laid out to provide public health services through disease prevention and management, public health policy advocacy, and health education for communities. A fourth and unique layer of governance is the oversight and role of private organizations. Managed care in the United States is the integrated relationship between healthcare financiers like large employers and providers through which coverage, rates, and shared risk for managing patients are negotiated to achieve efficient and affordable delivery of care. There are also special interest groups that influence the policies and practices through which care is delivered, such as the Joint Commission on Accreditation of Healthcare Organizations. The infrastructure of how care is delivered in the United States can be bucketed into 5 areas. Inpatient facilities for acute care requiring at least an overnight stay. Second, ambulatory or outpatient care is provided through a variety of available settings depending on the level of acuity or type of care needed, and the type of insurance coverage the patient may have. These settings range from typical outpatient physician offices, emergency or urgent care centers, virtual care or other telemedicine outlets, and home health, where home health care professionals provide a range of services in the patient's home setting. A third component of the U.S. healthcare system is its workforce. The healthcare industry is a major employment area funded both privately and publicly depending on the type of facility or care that is being provided. Lastly, as discussed earlier, there are specific government-funded and management facilities and care professionals dedicated to supporting active military personnel, veterans, and their families. The remaining gaps in care left behind by private insurers and veteran services are provided through Medicare and Medicaid services, as well as what's referred to as other safety net providers for vulnerable populations. In the United States, there are no nationally defined benefit packages for U.S. citizens. It is through private insurance that 67% of the U.S. population is covered for healthcare, mostly through employers. Included benefits vary and do not usually include vision or dental coverage. Following the rollout of the Affordable Care Act, coverage through the health exchange or small group plans are required to cover 10 essential health benefits, including pharmacy, drug, mental health, and preventative care coverage. After private insurance, 34% of the U.S. population receives government-funded coverage. Medicare services determined at the federal level include hospital, short-term skilled nursing care, physician services, medical equipment, and home health care. Surprisingly, there is very little outpatient drug coverage included in Medicare. At the state level, coverage for Medicaid services cover a wide range of healthcare services with additional benefits such as vision or physical therapy included at the state's discretion. Although it is not currently federally mandated, all states currently provide outpatient drug coverage through Medicaid. Lastly, 8.5% of the U.S. population remains uninsured. Although federal mandate requires access to acute care regardless of their ability to pay, the unforeseen need for this without appropriate coverage can likely lead to financial devastation. Now to discuss the performance of the U.S. healthcare system, I will hand it over to Yazan and Chizoma. Thank you.
Now let's discuss the accessibility of the U.S. healthcare system. First, we have to know that it is a multi-player universal health insurance fund and is best described as a hybrid system. Now, 10% of the people in the United States do not have insurance. That about 33 million people. And of those who are insured, 35.7% hold public coverage. Now, why is it difficult to provide healthcare coverage to everyone in the U.S.? Many factors play a role in this, including rising healthcare costs, economic downturns, and public program cutbacks. One of the biggest reasons is the high healthcare cost in the U.S., which we're going to discuss in a bit, when it is cheaper outside the U.S. due to lower taxes and salaries. The United States uses all four healthcare models. It has a leading healthcare technology and an ongoing innovation in medicine. It has a large and well-trained healthcare workforce and a wide range of high-quality medical specialists, a robust research program. Now, with all this, surprisingly, the United States ranks last on healthcare quality compared with the 6 leading industrialized countries. Indubitably, the U.S. economy is the world's largest and is the most technologically powerful. The U.S. ranks first in the number of new drugs and medical devices approval and leads in medical innovation, which goes hand in price. So if you have the money, you'll guarantee getting the high quality care. And probably that explains why the U.S. performance is lowest amongst the 6 industrialized countries, because they cannot afford to give the high quality service to people who cannot afford. It's good to mention here that the U.S. ranks number 27 in education and healthcare worldwide. As discussed in earlier slides, due to the ongoing top-notch healthcare technology, the United States has one of the highest costs of healthcare in the world. In 2021, U.S. healthcare spending reached $4.3 trillion. Now, the average cost of health insurance is $539 per month with a maximum out-of-pocket limit of $6,115 per year. The average annual premium in 2022 is $7,911 for single coverage. Now, the U.S. government does not provide health benefits to citizens or visitors, meaning that at any time anyone gets any medical attention, someone has to pay for it. There are many federal tax-funded insurance programs, including Medicare, Medicaid, and military health insurance programs. The biggest and the largest are the Medicare and Medicaid services.
Amadi. In this section of our presentation, I'll be speaking on assessing the U.S. healthcare system performance based on parameters like accessibility, quality, and equity. With accessibility, our focus is to determine the extent to which patients are able to get the care they need when they need it. For quality, we are looking at the extent to which the right care is delivered in the right way, while health equity considers the extent to which every person has the opportunity to attain their full potential of health. Comparing the US health system to that of other high-income countries, although the US outperforms its peers in the area of quality of care due to technological innovation, there are lapses in the system as a result of high healthcare costs and insurance coverage, as well as health disparities. To give further insight into accessibility as a performance index of the US health system, looking at the determinants and barriers to accessing care, which is an important part of achieving better health outcomes and controlling health costs in the long run. Essentially, access to care in the US varies by state, demographics, and insurance coverage. On the other hand, there are multiple factors that affect access to care in the US, such as transportation to care facilities, government programs and policies like Medicare and Medicaid, and also the income level of an individual. Although there are no established frameworks for evaluating the healthcare system, a number of different metrics are used to look at quality of care, such as safety, effectiveness, patient-centeredness, timeliness, equity, and efficiency. In addition, inconsistent or unavailable data and imperfect metrics make it difficult to firmly judge system-wide health quality in the US. The US continues to lag behind relatively wealthy and sizable countries in many aspects. However, a review of data suggests that the system is improving across each of these dimensions. To conclude this section, I'll be looking at health equity and disparities as a measure of assessing the US health system. The United States is one of the richest countries in the world, but it has failed to achieve health equity as disparities exist among certain population and groups. These disparities are often instigated by factors like geographical location, race or ethnicity, age, the social determinants of health, social economic status of an individual, and the cost of insurance coverage. I will pass on the stage to my colleague Megan, who would speak on areas of excellence.
Hi, my name is Megan Gomez. I'm going to be speaking on innovations in areas of excellence in the United States. First, the United States has high rates of cancer screening for particular types of cancers, including two of the most common types of cancer, breast and colorectal cancer. Here is data published from 2022 demonstrating the U.S. had 77% of women aged 50 to 69 that were screened for breast cancer. This is only second to Sweden, who had 95% screening rate. On the other half of the slide demonstrates colorectal screening for patients between the ages of 50 and 74. The United States had a rate of 68%, second only to the Netherlands. The U.S. does relatively well in overall cancer survival compared to other countries. Some of this advantage could be attributed to early detection, as we discussed in the previous slide. An article from JAMA evaluated 22 high-income countries in 2020, and U.S. overall cancer mortality ranked 6th behind Korea, Switzerland, Australia, Iceland, and Finland. In addition to cancer detection and treatment, the U.S. is the largest contributor to discovery of new therapeutics. An article in Nature looked at drug discovery during the time period of 1998 to 2007. During this time, a total of 252 total drugs were approved by the FDA. Approximately half of these were discovered in the United States, with the other developed countries, including Japan, UK, France, Germany, Canada, and Australia, contributing to the remaining half. Many biotech companies are located in the United States, driving this change. Overall, the U.S. has great access to technology. For example, MRIs are sensitive imaging techniques that can be used to diagnose and monitor diseases. But this modality is relatively sparse in some countries, such as Canada, which can lead to delays in diagnostic imaging and even diagnosis. This bar graph demonstrates MR units per million in the population, and the green bar demonstrates the United States. Only Japan has greater MR unit per population ratio that's higher. Access to clinical trials is another area where the U.S. excels. In the years from 1999 to 2019, you can see that the U.S. patients had access to around 138,000 trials, which is approximately 25% of the total trials. In contrast, China, which has the second leading nation, has approximately 8% of the total trials during that time frame. Data from 2018 examined ratios of licensed nurses per 1,000 people. The U.S. had the third highest RN per capita ratio. Only Sweden and Belgium had higher ratios. Next, Sylvia will speak on the United States and opportunities for improvement.
So now we're going to review the improvement opportunities. And in order to evaluate what we can improve, we first need to determine what are the problems with our current health system. So let's go ahead and review what Uwe Reinhardt, who is a famous health economist, wrote about this before he died in 2017. He actually wrote many papers, and before he expired, he wrote a book called Priced Out, in which he describes the healthcare system as a huge Pac-Man that is eating out the GDP. In a famous paper published in 2003, he described that the problem with the healthcare system in the United States is not the utilization. It's not that we use a lot of healthcare products, but rather it's the prices of the products that we use. So here's a quote from that paper. That he says that the facts suggest that the difference in the spending in the United States is caused mostly by higher prices for healthcare goods and services. See, the utilization is actually less than other countries like us. So let's take a look at what happens in Germany. And this is from his book. Here what they did is they took the expenses from the United States and they subtracted the expenses from Germany. So anything that is above zero means the United States spent more on, and everything that is negative means that Germany spent more. So when you look at the prices, it's clear the prices per capita spending in the United States is much higher than than Germany. When you look at administration, same thing. Administrative costs much higher in the United States. When you look at inputs, which basically means the number of products used, you see that actually the United States use less products than Germany. So Germans are getting much more healthcare, but at a cheaper price. So it is interesting what he mentioned about administrative costs. When you look at the number of healthcare administrators in the United States, you see that in the last few decades, the increase in the number of administrators has markedly expanded, especially compared with to physicians. So physicians here in this graphic are shaded dark, and administrators in healthcare are the rest, which is a significant proportion. So what can we do about the problems that we face in the United States, right? Yeah, our system is set up in a way in which everybody in the system is trying to take more and more money. Physicians, including me in that bunch, right? I'm a physician as well. Nurses, insurance companies, hospitals, pharmacies, everybody wants to take a bigger and bigger cut every year. So this was obtained from Uwe Reinhardt's lecture in 2013, in which basically he says that the private sector, meaning hospitals and insurance companies, should not set the prices unilaterally. And further, that the prices should be transparent. It should be like when you go to the store and you exactly see what the price is of a Mac or of a purse. In healthcare, the prices are not transparent, and further, there are different prices for different insurances, and within each insurance, there are different prices for each type of insurance plan. He took it one step further, and he said the prices not only need to be transparent, but it needs to be an all-payer system in which the prices are the same regardless of who is the payer. This is another perspective on why America has the problems that it has. And in this graphic obtained from the American Healthcare Paradox is a book which discusses why you spend so much and get so little. There's a figure there that compares different countries. Each column is a different country. And the darker shade represents the percentage of money, the percentage of the GDP is spent on health services, right? Like hospital care, in actually taking care of healthcare problems. And the lighter shade represents the percentage of the GDP that is spent on social services. And you see that for the most part, all countries spend more or at the same, a higher percentage on social services, except one country. You guessed right, it's the United States. The United States spends much more in healthcare services rather than in social services, which are the determinants at the end of what happens to the health of the population. So an opportunity there is that we should increase our spending in prevention rather than healthcare itself. And that will improve the social determinants of health, which are the underlying problem with the healthcare in our population. And you may say, well, that's a nice utopic goal, but actually Maryland has done an experiment in the last decade or so in which they have been moving their healthcare system within the state to that type of model. And now, during the last couple of years, they have a system that is called Maryland Total Cost of Care, in which hospital payments are set based on previous budgets. And once the hospital gets revenues equal to that set goal, the remaining, the excedent of money goes to preventative services, community partnerships, rather than going to the pockets of administrators. And the results of that Maryland program are actually very good. You see here spending, the total Medicare spending has decreased close to 5%. Hospital spending has decreased between 5 and 10%. The utilization of the hospital, so the number of admissions has gone down by 15%. And quality, preventable admissions has also decreased. And why is that? Because the hospitals are being incentivized to actually prevent hospitalizations, to maintain the health of their given population. And that's probably what the United States needs to do in order to decrease expenses moving forward. It is going to be challenging due to our political situation. Unfortunately, in the United States, legislators who at the end will or not allow for this Maryland experiment to expand across the United States, those legislators receive money from the lobbyists that are hired by insurance companies, pharmaceutical companies, physician organizations, etc. So we shall see what happens in the United States. We thank you very much for listening to our presentation, and following these slides, you can find the references if you care to review them. Thank you very much again, and I hope you enjoyed it. Bye-bye.